let's talk about the pelvis. Now, the first thing we need to understand about the pelvis is that it's divided into three different sections: the ilium, the ischium, and the pubis. The vast majority of the pelvis is made up of the ilium, whereas the other two, the pubis and the ischium, are going to be that of two smaller bones located more inferiorly. But the question is, well, where are they? Well, if you've ever sat on someone's lap, or perhaps someone has sat on your lap, and you've told them that they've got a really bony bum, well, you can thank the ischium for that. And the reason I'm telling you that is because this ischium is located more posteriorly. It's towards the buttocks region, whereas the pubic bone is closer towards, or sorry, I should say the pubis bone is closer towards the pubic region, more anteriorly. So this is my pubis, and this is my ischium, whereas the rest is the ilium. So now what we need to do is we need to start thinking about, okay, well, what are the different landmarks? What are the different features? What are the different projections? If I were to show you this, we can appreciate one bump, we can appreciate a second bump, a third bump, a fourth bump, and also a fifth bump. Now, these bumps are what we call spines, and depending on where they are, they get a different name. If they're on the front and on top, it's what we call the anterior superior iliac spine. If it's on the front but below, it's what we call the anterior inferior iliac spine, and these are going to be important a lot of the time for muscular attachment, namely things like the sartorius or the tensor fasciae latae, right? Now, if you come back here more posteriorly, because we're on the back and we can see two bumps, the question is again, is it on top or is it on bottom? This is my posterior superior iliac spine, and this is my posterior inferior iliac spine. And recall, if there's some type of bump or projection, there's a very good chance that it is for muscular attachment. Okay, the last one, down here more inferiorly on the ischium, is what we call the ischial spine. Okay, the ischial spine. Following along, what you're going to come across is this big groove here, or what we call a notch. And because it's big and because it's a notch, it's what we call the greater sciatic notch. And it gets the name sciatic because the very large sciatic nerve that's going to be running down and innervating the more posterior aspect or more posterior compartment of the thigh runs through this notch. Okay, same principle. We have here the inferior sciatic notch, or what we call the lesser sciatic notch. And then if you make your way down, again, more inferiorly, recall that we've got the pubis and we've got the ischium. If you're looking on the back of the ischium, you come across this tuberosity, and it's what we call the ischial tuberosity, and it's responsible for attaching a lot of the hamstring muscles on the posterior compartment of the thigh, namely the semitendinosus, the semimembranosus, and things like the biceps femoris as well. If you make your way more anteriorly, again, remember that we're on the pubic or within the pubic region now, so it must be the pubis bone. We come across this tubercle here, and this is what we call the pubic tubercle, and it's responsible for attaching the ligament that comes from here, and it goes all the way up to here to the anterior superior iliac spine. If you were to draw an imaginary line, that is what we call the inguinal ligament. And the reason this inguinal ligament is so important for attaching the pubic tubercle and the anterior superior iliac spine is because we've got a lot of large vessels that pass underneath this inguinal ligament. Things like the femoral artery, as it continues from its more proximal continuation as the the external iliac artery. But also we've got the things like the femoral vein, and we've also got some lymphatics, and we've also got the femoral nerve that sits around that region there in what we call the femoral triangle. A few more things to go over. If we come back here to the ilium, we can note a few things. If I were to ask you to put your hands on your hips, what you're actually feeling is that of the iliac crest. And this is important because, again, it acts as a very important anchor point for a lot of large muscles. And we then come across the iliac fossa, so the iliac fossa. And if I were to turn this around, actually before I turn it around, I want you also to appreciate this very rough region here. And the reason it's quite rough here is because it's attaching to another bone. And you might be asking, well, what is that bone? Well, in this case, it's actually the sacrum, and it makes up a joint. It's what we call the iliosacral joint. Okay, so here is where the sacrum is going to be articulating. So if I were to now flip this around and show you the surface of the ilium here, what I want you to appreciate are just a few things. I'm going to draw it out for you because it's a little bit difficult to show you on the model itself. So I'm just going to draw it out. And remember that this is quite rough, so I apologize. You're going to have to bear with me. But what I've just drawn out are the gluteal lines. Okay, so recall back the three large I shouldn't say large, but the three gluteal muscles. We've got the gluteus maximus, the gluteus medius, and the gluteus minimus. And of course, because they are all muscles, they need some type of attachment. The question is where? In this case, they actually attach a lot of the time to the ilium. Okay, so these gluteal lines, what we call the posterior gluteal line, because it's on the posterior aspect, the anterior gluteal line, because it's more anterior, and the inferior gluteal line, because it's of course more inferior, are going to be acting as attachment points for the gluteus maximus, the medius, and the minimus respectively. Okay, so keep those in mind. Last thing to finish on, if I were to just turn this back around, you're going to come across a very large hole. And recall that hole is what we call foramen. Now in this case, it's what we call the obturator foramen, and this is actually one of the largest holes or largest foramina in the body. And the reason it gets its name obturator is because one of the very large obturator nerves pass through this foramen and actually innervate the more middle or medial compartment of the thigh. So I'm going to leave you with that, and let's move on to some of the other bones that make up the lower limb.